So in our meetings, we like to practice these agreements. I'll just go through them with you real quick. We have practice active and empathetic listening and sharing. Challenge the idea and not the person. Be both teachers and learners. Take space and make space. Stories stay and lessons leave. Use I statements. One person speaks at a time, and be here now. All right, so now we'll go ahead and get started with a little round robin introduction. Just let us know your name, where you're located, and are you a tea person or a coffee person? I'm Laura. I am currently located in Hollister, California, back in my hometown for the week. And I am a coffee person for sure, all the way. So let's go ahead and I'll start at the top of my list. I have Bobby.
Hi, my name's Bobby Reed. I'm here in Pittsburgh, Pennsylvania, and I am a tea person. Jasmine green tea.
That does sound good. Thank you.
Yeah. Thank you.
Linda. Linda Ewell. No, we can come back to Linda. Dorothy.
Dorothy Winningham. I am now located in Georgia from Virginia, and I am a coffee person. I have in the past, was not really a tea person, but I did do tea for a while there, but I'm truly a coffee individual.
Love it. Thank you. Thanks for joining us. Haroon.
Hi, my name is Harun Rashid, and I'm from California. And I'm a coffee person, sorry.
Coffee person. Nice. Nice. Thank you. Thanks for joining us.
My pleasure.
Dr. H.
Harvey Ellerstein from Central New Jersey, where today it's going to be 93. So iced tea will be my choice. And as a child, I grew up with tea and milk. So I don't know how many others. Thank you.
Thank you. Janice.
Hi, I'm Janice Tufty. I'm in Seattle, Washington. I'm sorry, my camera's not on. I'm a coffee person. I was a tea person when I was young, but I'm definitely a coffee person. But I'm now enjoying hibiscus tea now and then as an anti-inflammatory.
Oh,
Thank
nice.
you.
Thank you. Like in Seattle, you kind of have to be a coffee person, huh?
I know, I was laughing when I saw Laura. It's like 60 degrees. We're like living in it's not even 60 today here. We had like 3 days of 70-degree weather this whole year.
Eventually we'll get a summer.
Eventually.
Thank you.
Nice to see you.
You too. Lindsay.
Good morning, everyone. I'm Lindsay Galley. I'm located in Sacramento, California, where it's only going to be 74 degrees today. So I think sounds like the East Coast took our summer for a day.
Yeah.
And I am a coffee person, iced coffee to be specific, year round.
Thank you. Lisa.
Hi, I'm not awake yet. I don't do tea or coffee. Thanks.
All right. Thank you. Lori.
Hi, I'm Lori Albers. I'm calling from the balmy state of Wisconsin. Today it's really hot, but I am in my basement freezing. And I work for Children's Wisconsin, and I am a tea drinker, love tea, and I am channeling my inner Captain Picard today with my Earl Grey.
Love it. Love it. Thank you. Teresa?
I'm Teresa Prouty from sunny, balmy Dayton, Ohio. And I'm with Lindsay. I am a coffee drinker, but iced all year round.
All year. It is delicious. Thank you. Belinda?
Where is it? Oh, good morning. I'm calling you from Los Angeles, California, and I drinking coffee this morning.
Thank you. All right. And Linda, were you able to get your microphone working?
Yes, if it's me, Linda Ewell, I'm in Southfield, Michigan, and I drink coffee and I work for Beaumont Health.
Thank you. Thanks for joining us. Libby?
Good morning, everybody, and thanks so much for joining us today. I'm Libby Hoy. I'm in Long Beach, California, where it's a little overcast, but we call it June gloom. By noon, it burns off. And I love black coffee. Nothing fancy about it. No sugar, no cream, no nothing, just a good, strong cup of black coffee.
All right. Thank you. And Mary?
Everybody, morning and afternoon for all the time zones. Great to see everybody. Glad to be here. Coffee for me, and I'm very fortunate that Kona Coffee is just down the road. So it's sounds like I'll probably need to send Libby some of that. So,
Oh my
but
gosh,
later,
I search
yeah.
it out everywhere.
Well, the good news is they sell it at Costco here, so it's kind of fun. But later in the day, I have to say some herbal tea is, there's nothing better than that, just to help wind the day down. So
Thank you. Thank you. All right. Did I miss anybody? My list was kind of jumping around.
I think Mark has joined us.
Oh,
I
think he just joined.
Yep.
Hi, Mark. We're just doing introductions. If you want to tell us your name, location, and are you a tea or a coffee person?
I'm located in Hawaii, and I'm a coffee person. I'm with Mountain Pacific, and I really enjoy working with Mary Schramke.
We all do, I think.
Yes,
Yeah.
definitely.
Thank you. Thanks for joining us.
Yeah.
All right, we'll go ahead and get started. And speaking of Mary, I want to welcome her. She's, those of you that don't know, a patient and family advisor, and she's very involved with us at the PFA network. She's going to lead our discussion today in public commenting. So Mary, I am just going to pass it off to you.
sounds good. You can go to the next slide. As Laura said, this is just a way for us to get together and brainstorm and learn. I just have to say, from a disclosure point of view, I'm not representing either CMS nor National Quality Forum. This is just based on, my learnings and what I found in this last week or so on, public websites. So if I've made mistakes, they're my own, and happy to learn and correct them as we go. But I'm really looking forward to everybody's inputs and learning, so we can maybe do better on the public comment side. Next slide. So what I wanted to do is just briefly outline what the topics were, just to frame the discussion. I thought really quickly I'd go over what quality measures are, since that's what we would be commenting on and why they matter. There are a couple entities that coordinate public comments for Center for Medicare and Medicaid Services. We'll talk about that very briefly. And then there's some questions that I think, once we go through this overview, that I wanted to start the conversation with. Is what I thought mattered is, how do I know what's open for comment? What issues are being discussed? And then at the end, really, how can we make a difference? And hopefully we'll have a lot of time to brainstorm and see what's next. Next slide. So what is a CMS quality measure? As I mentioned, that's really what the public comment opportunity is about. Lindsay Galley and others at PFCC Partners has an amazing set of seminars and learnings around quality measures. But I just wanted to quickly remind everyone at a very high level that they're tools that help improve the quality of healthcare. That is, they try to apply consistency so that they can be measured and that they're accountable as care providers. And that starts at the CMS government level since they're a payer, and also they are used for payments for Medicare and Medicaid services. Next slide. So why should you care? Number two, as I mentioned, it's about the money. Quality measures are linked to clinician payments, and how organizations are judged. And so these are the two latest acronyms that are used uh, to help organize how these payments go. So just as an awareness piece, they're called merit-based incentive payment system and the advanced alternative payment models. Again, we could spend days talking about these things, but I just wanted to let you know that quality measures matter to us as patient and family caregivers because, it's sort of the follow the money thing. So next slide. So in trying to understand quality measures in CMS, I wanted to just briefly remind everyone again at a very high level that CMS has a strategic plan. It has evolved over time. And this is the one that I found that was posted just in May. The things that I wanted to mention to you is that they do align very much with the quality measures, and the quality measures will support these strategic pillars. In particular, on the far left is the advanced equity. They're really working to improve equity in all the quality measures, and I'll mention that in particular with the National Quality Forum. And also at the other end is to foster excellence. And in the middle is something that where we fit in, I think, is to engage partners. We're part of their community, and I think these are the sorts of things that are very encouraging and are our opportunity. And on all of these, I've tried to put the web link where this information has come from. Next slide, please. So one of the things that is part of the public commenting process it is the way CMS is organized is called the Meaningful Measures Program or the Meaningful Measures Initiative. I was actually privileged to be a part of some of the quality efforts with CMS through the PFCC partners. Libby and her team introduced me to them, and I actually helped them with some of their efforts back in 2017, 18, and 19. It was originally intended, my understanding was to try and reduce the number of quality measures. There are thousands of quality measures, and the first sort of go round in 2017 was that they actually put together a website that finally listed where you could search through all the measures and figure out ones that were active and that sort of thing. It's evolved into version 2, which I'll talk about really briefly. But I also wanted to point out that it does take in stakeholder feedback, and that it also tries to align with the strategic priorities of CMS, in terms of ones I just mentioned. So there are organizations that help them do this. They partner in particular with the National Quality Forum. Again, that's the group's efforts that I'll very briefly talk about today. I've worked with them some, and it's just an opportunity or maybe a door that we might decide to go through in greater depth. Next slide. So the measure management system and why it matters. It's they're there to offer support and guidance to the people who develop measures. And they really want to help, make sure that these measures are put into in a quality framework. But they're also chartered to educate and inform stakeholders. And that includes us as patient and family caregivers, but there are also other stakeholders as well. And the thing that's important to remember is that is in any measure, just like, say, if there's something in the tax code, um, it doesn't, it changes over time and it has a life cycle. So, and some of them are used for a while and then they're retired and then they're replaced. So I think it's important to understand that, a measure is not cast in stone, and that it has a life cycle, kind of has that biology feel to it. So on the next slide, it it talks a little bit about the process. Not so much I think the thing here is not to read the fine print, but to realize that in the middle, there is that concept, that little light bulb of what it is you want to measure. And if you go to, around the circle, you can see that the arrows go in just about every direction. So it depends on where they are in the life cycle as to, once the idea has come about, it's tested, it's actually implemented, and then it's evaluated over time. And then you can see how it sort of holds up based on its original specifications. So there is a framework. Again, these are sorts of things that it's not so much to know everything about each one of these boxes, but to realize that it has a cycle. It comes, it comes to life, it's tested, it's implemented, and then based on the specifications, it's judged. And we have opportunities to weigh in at just about every one of those stages. Next slide. So the interesting thing about it, about CMS, is the head of CMS is called the administrator, and that person leads all of CMS, and they report to the Department of Health and Human Services. That's the secretary. That is a cabinet level position, and that obviously changes with every change of administration. So in this administration, they have looked at meaningful measures and come up with version 2, which is not too uncommon. But the interesting thing about it is that they've acknowledged that they need to transition away from trying to reduce the complexity to making sure that the ones that they have promote value-based care and that they promote health equity. And I think, again, that's something that I think we can all resonate with, but it's just important to know what the organization's priorities are at the moment. And that the other thing is that they're really working hard to start to include patient-reported outcome measures. And that coincides with the added effort to make sure that measures are aligned with our digital access, computer access to our health records. And so I think that they're, working very hard in that regard. And again, there's, plenty of information out there about that. But lastly, and most importantly, they're really working to implement measures that reflect social and economic factors that, that influence our health. And that's where, if you look at the diagram on the right, that the patient and caregiver voice and health equity are the foundation of their approach or approaches. And so I think, again, that's something that is worth noting. This is something that was just recently published, and is very encouraging and can help us frame our approach to public commenting. Next slide. So the other organization that I mentioned, besides the Meaningful Measures group through CMS, is the National Quality Forum. And they have a role there are other major groups that you know, give comment to and support the development and implementation of measures. But National Quality Forum is funded by CMS and has a mandate, and they have developed what's called a Measure Applications Partnership, or MAP. And they've had this for some time, but they've just recently worked, as it turns out, to incorporate health equity into their Measure Application Partnership. So they've just formed this new advisory group. And then again, on the acronym side, they are commenting on and help evaluate measures under consideration, or MUCs. So it kind of resonates with me, because sometimes when you look at the list of quality measures that are under consideration, the list is rather long. And so I kind of feel like I have to muck through those. So that's just my attempt at humor at 6 a.m. So next slide, please. So again, this isn't meant to be something you can read, but I just wanted to give 2 landing pages to show how, and sort of the how and whens of the Measure Application Partnership. They do have a web page that talks about what events are coming. That's on the left side. And then right next to it is a tab that is called Materials. And I think there are 2 things to see here, is that, say the first one is that it started in July of 2021 and they're now at June of 2022. So a lot of these Measure Application Partnership projects last for years at a time. They have regular meetings and they have materials that are publicly available. Some are only available if they're just being developed and haven't been finalized, just to the team members themselves from the National Quality Forum. But I just wanted to give people the sense that that's part of our challenge, is that these efforts do take time, and that if you look at the material section, a lot of these materials are anywhere from tens to hundreds of pages long. So it's a challenge, but at the same time, they do have comment periods. And again, that's an opportunity. The other issue is that sometimes those windows are fairly short. They can be a week, and sometimes they could be a month. And it's just, if you're on what's called a list serve, that you sign up for emails from these folks, you'll get a lot of emails. And you have to kind of sift through these, and sometimes that can be challenging as well. Now, that's the good news, is that these comments are all written down and captured electronically and summarized. And again, the comments are available. So even if one single individual made a comment, it is captured and considered. And I think that's really important for all of us to understand. What they do, graph these responses out, and you can actually read each individual responses, which is what's shown under the comment period down at the bottom. Again, in fine print, for those of us who are older, it'll be like this, but they're there. Next slide. So this is another way, from the National Quality Forum perspective. They have so many projects, but on the left side is just on a daily basis. You can see what's going on at the National Quality Forum. Some of them have comment periods. That's the one that's on the top of the page that's open. It's for the health equity advisory group, just as an example. And then if you have a comment period that's open, on the right side, what you can see is that you can click on the green box and collect and submit your comments. And Janice is correct. That's true. You can actually sign up for specific projects, and that's a really good point. So thank you for that. But again, you can view comments and you can make comments. And again, this is quite an improvement over the years. It's a great way to see what's going on. So kudos to them. And again, it's a potential opportunity for us. The other piece is that there are new opportunities that come up. So it's a question of how do you know to sign up if you don't get them all? So it's kind of one of those chicken or the egg things. Next slide, please. So another way to approach this is to look at the National Quality Forum projects. And they do have a project list. As you can see up in the upper right-hand corner, they have the NFQ work. And you can look at projects, and they are alphabetized. And it does summarize, what their current state is. Are they open for comment? Or do they have a report that, that has been written, that sort of thing. And again, this is only 3, and I think that I didn't count them all, but there are quite a few. So that's another way for us to understand, what's available and what's not. And as new projects come along, you may be interested in the title, but there was a question that came through that Laura mentioned about, say, a particular disease condition. And it's a question to the team, and there are more experts out there than I ever could, understand. But I'm not sure exactly if, how we would know if, say, in the all-cause admissions, readmissions, if it has something to do with, opioid abuse or substance, or sepsis or kidney failure. In other words, patients and families might look at it from a condition point of view, and sometimes the project titles have to do with the way the organization works. So again, that's another opportunity / challenge for all of us to try and understand what's going on so we can comment. Next slide. This is, again, a little more detail on the fact that, with the measure application partnership with CMS, they do have comment periods for particular projects. And what I wanted to let you know is that when they do graph things out, on the right side, they cite the organization that the comments came from, and they break them out, by percentages. And so I think, again, that's an opportunity for us as an organization to have some visibility, as well as some impact. And just to let you know that this is one of many ways that they, look at public comments over the period and look at, and the other point that I'd like to make is that there's a lot of different sources. If this is not a live page, but there are a number of organizations that make comments. Next slide, please. So that's the National Quality Forum. And as I mentioned, their methods application partnership with CMS is is very much, a workhorse in terms of the number of projects that go on that they try to consider. And they've been very helpful with CMS and the Meaningful Measures group to try and reduce the number of meaningful measures. And that's really why where the title of the group came from, is that they really wanted to make these measures meaningful. And the question is, meaningful to whom? And so that's one piece. But the other piece is that, that CMS does have a way for us to get involved, even if you're not connected or even aware of the National Quality Forum's Measures Application Partnership. You can, and they do encourage that you, as an individual, as what they call a beneficiary, if you are if you are receiving healthcare, that you can engage with CMS, and they've made it a little more understandable. This is a newly updated page as of May. You can join a technical expert panel. You can participate in public commenting, which is what we're discussing today. And you can learn more about calls for measures. In other words, get on listservs and be specific. I've haven't really looked at that in great depth. But you can also learn. They do have other sources of information that, that can help us learn about what's going on. The short story is they're also very involved, and depending on how much time you have, they're very, very informative. It just sometimes they can be rather lengthy, but they're there, and that's the great news about all of this. Next slide, please. So what I wanted to do was just take a look, like we did look a little bit at the National Quality Forum, ways to look at what's going on in their measure application partnership. You can look at their calendar. You can sign up for being kept up to date by email of any particular project. They have, great communication tools on a project basis, and they also help you understand what public comments have been given on those projects. On the CMS side, they do offer public comments portal, and they do list what's up here is the current comment opportunities as was posted yesterday. And there are two. And I might mention in particular the one at the bottom, which is the development of CMS quality measures index. I personally think that this one is a real opportunity for us. Unfortunately, or whatever, it's the public comment period closes in a couple of days. But it's work that's been done by HSAG, and that's an organization that that we have, I think, pretty good ties with, and they've written a 13-page report about really how they make the point that the General Accounting Office a couple of years ago, which is the big oversight organization within the government, they basically told CMS that your quality measures are across all those different organizations that you ask to help, the Meaningful Measures Group, the National Quality Forum, American, there are other groups, sorry, I can't remember all the acronyms, but they're consistently inconsistent is the short story. And they've been asked and charged to come up with a new way to do this. So that's something that, we can look at in greater depth if the team thinks that that's something we should do. I'll just put my plug in. I'll take advantage of being the speaker, that I think that's an opportunity for us. Next slide. So, again, I want to make sure we maximize the collective wisdom here of the team. What I tried to do is just talk about, what they are, the quality measures that we might comment on, why they matter. Talk about how CMS in general is organized, where they're headed, and one of their very important strategic partners, the National Quality Forum. And really, like I said, just very briefly skimmed how do I know what's open for comment. I think one of the points that I tried to make, and I didn't give a lot of detailed examples, is that a lot of these issues being discussed when a measure is being developed or evaluated is that the issues are complex. And it may be that we can take a look at the new proposed measure index report from HSAG and see if that's a tool that we could use along with others that others may come up with, so that we can make sure that our voices have maximum impact and effectiveness. So I will open the floor to comments and questions.
I have a question, Mary, if that's okay.
Fire away.
So once again, I'm Lori from Children's Wisconsin in the great state of Wisconsin. And I hear that there are so many ways that we can get involved. So how can we as healthcare professionals get our systems on board for allowing us to get involved in being able to do public comments and get involved in some of these organizations and really being able to dive into this material so we can bring it back to our system.
Lori, this is Mary. I think that's a great point. My limited experience is that the topics, and I'll use the organization that I do work with as a patient family advisor, which is Sutter Health in Northern California. They have a quality improvement team, and it's someone's job to kind of keep an eye on these sorts of things. I mean, typically, like I said, the way clinicians are paid through the MIPS program and the alternative payment model, there are folks there that keep an eye on those sorts of things. And so one idea would be to have folks that are tracking those things to track these measures and see if you can route them to the, the right folks. One example was that public commenting just closed was the patient reported outcomes measures. There is a team at Sutter that, that looked at the 145-page report of what's done and tried to make some comments, but I have to say it's a lot to wade through, but that's just one suggestion.
And if I could, maybe another suggestion, Lori, would be, public comment is just that any individual can comment from the individual perspective. So you may, because there may be times where a patient and family partner perspective may not be the same as an organizational perspective. And so I think we don't want to lose the patient family partnership voice in those comments too. I think that's, I don't know how you would manage that with your organization because I don't work for a large health system, but you're an individual as well.
Great, thank you. So I could see sharing that with families so they know that these are options for them to get involved and to make comments and to learn more about quality measures as well. So thank you for that, Libby, and thank you, Mary.
Yeah, and Lori, I couldn't agree more with what Libby was saying. I mean, from an organization's point of view, I can't believe I didn't say this, but is that organizations that are connected with patient and family advisor councils, or patient advisory groups or patient advocacy groups in the community, it's ways to form bridges, with different advisory groups, whether they're formally organized within the hospital system and healthcare system that you are, part of. But there are also different community groups that you could reach out to as a way to form better ties and use this as an example of ways to collect input. So I think, that's an option too. So Janice, I think you had a question.
Yeah, not really a question. I posted the new MMS, CMS, whatever the measurement hub, and much of what you showed, I don't know if you put that on there. I didn't see it in one of the slides, but it might be there, but I posted it in chat and I could do it again. It has everything on there, how to get involved with the TEP, how to give comment. So it's all in one place, which it didn't used to be. I used to search public comment. Where to look, right? You have to go up in the corner. Their website is better now. It used to be really clunky, but yeah, you have to just kind of search, familiarize yourself with the with what's available. And I serve on the MAP coordinating committee, so it is PFAnetwork. Libby and Stephen have also served on that, and I think I'm the first identified just only as a patient, not an organization, that was involved. But how I got involved with NQF really was giving public comment, over the years, attending things that were of interest to me. And so you have a higher chance of getting on a measurement if you, I mean, I'm guessing that, right? If you attend and they see your voice, that you might have a higher chance of getting on some of the TEPs, because this last round, we had quite a few people that applied and a higher number did not get on, right? So I just think that if they kind of recognize your name, they know you're active, you're more likely to be more active on the TEP itself. So.
Good point. Thanks for all your work.
Thank
And
you.
just as a note, that one slide that had the 4 squares on it is literally a screenshot from the webpage. So yeah, and
Okay,
my
great.
apologies. Yeah, thanks. That's awesome. Yeah.
Thank you, Janice. Do we have any other questions or comments or ideas for Mary? Oh, Dr. H.
Mary, you mentioned something about, there being a life cycle and it being tested. What is the determinant that being that they are so overwhelmed with so many measurements that something does get tested or goes forward or something doesn't?
Harvey, this is Mary. To be honest with you, I'm not an expert in that selection process. And I think that was one of the charges, so to speak, that was made by the Government Accounting Office a couple of years back, that they gave the HSAG to try and figure out a way to standardize this. I mean, each group has its own standardized process, but it's. I think the way they put it was consistently inconsistent. I mean, it's just not across the board, and they're trying to come up with a new system that um, uh, changes this to where it is standardized. And for me, it's an opportunity. I think if we took a deeper look at that framework, I think that's an opportunity. It brings things up at a higher level. I don't know, Laura, if you want to do a screen share, I can show that really quickly. Sorry, I just found this thing yesterday. So but basically, if you look at, oh, sorry for the what they, again, it's a long report, but these are the domains that they're proposing that they try to score, and there's some detail in there, and I'll post the link. I think the link is in there, but I'll send that out again in a minute. But one thing to me that's where they make the point that there are 3 domains. They also make the point that there are different variables that are scored, and they have a scoring system, which is basically, sort of red, yellow, green, fairly simple and straightforward. And they say there's differences, the numbers of variables are different between these different domains. But the one thing I would point out that I personally will publicly comment on is that if you look at feasibility and usability domain, they look at provider burden. And that's fine. But what about the burden to, patients and families, or is it feasible from a patient and family point of view? I mean, these are all things that are in the strategic pillars for the Center for Medicare and Medicaid Services, and I'm not really necessarily sure where they're looking at equity. So these are all things that it may be an idea is that we try this scoring summary out on some projects and see and test this and see how good is it, and maybe sit down with HSAG and somebody from a particular project at the National Quality Forum and see if we can't use this as a way to organize our thoughts, see if it helps us understand the issues, and try to get some standardization. I don't know if that makes sense.
Yeah, thank you.
I'll stop the share. So
We've got some great comments in the chat too.
yeah, I think the chats are the points are extremely well taken. It's not that they're anybody's. I mean, they are looking at other measures, and they're extremely mindful. I think it's just a question of how we can maximize our voice on sometimes very complicated issues.
Exactly. And I think if I could speak up, I think that, it's taken me a couple of years on the MAP coordinating committee to really understand get my arms around kind of the work that's being done in measure development. And you've laid this out so beautifully, Mary. I really appreciate your presentation today. I think what I keep coming back to is knowing what I know, and that is my lived experience, right? But I do think that there's some opportunity here that you're bringing to us around how can we amplify the voices as individuals, but also as a network of patient and family partners that is beginning to get a foothold in the measurement space. And I think that's really important. I think that, influencing like that, what you just showed, it just jumped out at me that equity was missing in that domain, in those 3 domains. It wasn't called out. And yet, so that's kind of at odds with the CMS strategy in some regard. So I think those are the kinds of things that we look for naturally and really can amplify those messages. But yeah.
No, it's Mary. I couldn't agree with you more on a number of counts. One is it's taken me a while to get my head around this. I've been working on this for years and kind of dabbling at it from the side. You guys have been great leaders in this regard, and I'm so grateful for that. And I want everybody to know that, you all have done amazing things as an organization representing us. The second thing is that at least at the National Quality Forum level, they do graph out, where these things are coming from, and maybe those are measures or ways that, CMS can, there are lots of things where one organization does really well, and maybe we can cross feed on best practices.
Mm-hmm. Janice?
Yes, this might sound a little bit odd, but I know some of us that have worked on the MAP and a few other of the higher up committees recognize the individuals are from around the nation, right? So they have different views, right? So there is individuals that don't feel that health equity is going to be easily measured or easily implemented into systems. How do we do that? The burden, is this acceptable because everybody should be treated the same? This is very real. And I anticipate or I expect that might be part of what's going on at HSAG. They were not able to come to a consensus about equity. What NQF did was create a separate equity group that looks at all the different, not only MAP, but the other groups, and provide insights on what might not work on this measure or what needs to be done on this measure. And so that's been very beneficial, right? But it's, some people might be serving on both, but the separate equity group in itself that can be, somebody that brings their expertise is very important. But I still, I believe we should put it in there. But there is a number of people and doctors, whatever, health systems that believe that everybody should be treated the same. And so equity does not necessarily need to be addressed, right? And what I like about NQF is they do a good job of, facilitating those discussions because they don't get heated. Everybody's very respectful, even if we don't agree with one another, right? But it is the way it is in their area, where they live. That is the standard belief, and we have to take that into account and work with that too.
It's a great point.
Yeah, this is Mary. I couldn't agree more, and I think that's it goes back to the sort of the scientist nerd piece of a lot of times these measures traditionally have been numbers, and those are quantities that are measured, but there are also essentially impact statements that can be graded, about how people, what the outcomes are or what they think about things. Those are more qualitative measures, and those indeed are, from a measuring point of view, harder to measure and to standardize. And how do you measure what somebody thinks? There are ways to do that, and I think that it's great to know that the As I mentioned, the equity team is part of the National Quality Forum's measure application partnership, and they have a special group for that. And it's great also to know that that's sort of how we're evolving. It's not easy, and it's hard to build consensus. I think back to Libby's point, we can take the forum that we have in measure development on the PFA network and, maybe go there. So as far as.
Yeah, I was really shocked. 5:30 in the morning, I'm getting text messages.
All right. Thank you so much, Mary. Does anybody else have any other comments or questions or again, ideas for this topic?
I'll just add one thing that is important to some of the people that might not, if they do want to nominate themselves, or if like PFs, Libby and the PFCC partners will put out a call, are you interested? These are available nominations. And a number of us do that on their own, right? I've done it for years too, and I'll send it individually to individuals I think that might be interested. But I purposefully send it to individuals from diverse backgrounds to try to bring in those voices. And I've been, I think 3 or 4 people I've, recommended to them directly to self-nominate have been nominated. So, that's something else we can do. And it might, it's not necessarily ethnicity or race. It could be where they live, their income, their care, whatever. Diversity means a lot, but that is what brings that equitable voice in. And so in nominations, regarding nominations, NQF, you will receive a stipend if you're not affiliated with an organization. It's kind of tricky. That's an issue there. If you are representing an organization, then you do not receive honorariums. CMS, I don't think you don't receive honorariums unless you go like with the PFAnetwork and PPIC and other organizations that are bringing people on to the TEPS. I don't know if, that's kind of the next step. There's public comment, but nominating, I don't know if you want to touch on that a bit, Libby, or, because there is opportunities for CMS TEP, honorariums if you go through the groups.
Yeah, and actually, Janice, just as a point of clarification, when PFCC partners, actually, we do get stipends for NQF nominations because we are a patient family driven organization. So it is we're a bit of an exception. So on most cases, you're not going to find that in the print, but in most cases, we do figure out a stipend. At least we're not paying for our travel and things like that. So
yeah. Because you have to check a box. I'm just warning people, you actually check a box. Yeah.
And it is intimidating. Right. So I'm glad you brought that up. Yep. You're absolutely right. And then you're also correct in that as a partner to specifically Acumen, who develops measures and embedding the patient family engagement across their work, we do provide stipends for participation in those, not only just TEPS, but also in focus groups, as I think you'll hear about in just a second. Right, Laura?
Yes, actually. Yes, so great. Thank you. Good transition over to our next, thank you. To our next slide. We do have a new engagement opportunity available for you all. Acumen, like Libby said, is looking for focus group participants. We are looking for patients and family member caregivers with experience with prostate cancer and rheumatoid arthritis, and also receiving Medicare along with those. And the focus groups will be in July. So if you are interested, I have in the chat now an interest form for you to fill out. It's super simple. Just let us know your experience with those conditions there, and we will be in touch with you very soon to get you all set up for the focus groups. Did I miss anything on that, Libby?
I think I just want to mention that this is a longer term project as we develop this measure. So there'll actually be 3 rounds of input, either through focus groups or interviews There will also be an additional opportunity, which will have an additional stipend to participate in the work groups as well. So it's the overall is 3 touch points or 3 opportunities to have input over between July and March of or April of 2023. So just wanted to let you know that was a longer. And Mary, you did that with us on the last round, right? On wave 4. We're on wave 5 now.
I did, and I would strongly encourage anyone and everyone to get involved. You know, you can bring a representative voice to the table if you know someone who's been working on these topics. You don't have to be the person themselves or even the direct caregiver. I think it's an opportunity to really reach out and have more voices heard.
Thank you. Yes. All right. Oh, and Dorothy just made a comment. Yes, we initially had kidney transplant in there, but it was all full. But Dorothy, I have you on the list. We have lots of wonderful people
Thank
who have
you.
experience with that. Yes. I don't want you to be worried. We have you down.
Oh, no, I wasn't worried. I'm just, wow, this must be something different. So no problem.
Nope, the same one. We just got
Okay.
a lot of interest with the kidney transplant group. So you're all good. All right. And the PFA network is starting a campaign called Pass the Mic. Janice kind of touched a little bit on that earlier with passing the public commenting on to people. And that is a perfect example of Pass the Mic. It is our effort to amplify the voices which remain underrepresented in our journey towards improvement healthcare for all. So we invite you to share any opportunities you have with your peers, friends, or anyone in your community that may have a different, does have a different voice than you. If you don't have someone in mind, but you do have an opportunity that you think would be good to pass the mic to, feel free to contact me. My email is here, laura@pfccpartners.com. And we have, of course, the whole PFA network that we can pull from, and we can pass the mic to members in the PFA network. There are a few ways that you can pass the mic. You can invite, like I said, invite a friend or a peer or someone who represents a community different from your own to any upcoming meetings. You can request that your health system include additional voices in their projects. And you can, the next time you're invited to a new opportunity, you can request to bring a friend or peer along. So they don't necessarily have to take your spot in the opportunity. You can share your spot and bring people along. And of course, you can always provide ongoing guidance and support to help the person you've passed the mic over to. So that's just something we're encouraging everyone, not just the PFA network, but everyone to just pass the mic and get new voices in healthcare. And then if you have a topic or a project that you'd like to share with the PFA network and you want to do a coffee chat just like Mary did today, feel free to, again, let me know in my email, laura@pfccpartners.com. I'm also going to put we have a quick interest form for that as well, and we can get you all set up for a coffee chat in the future. And that wraps up our coffee chat for this month. If we have any other questions or comments, we're 1 minute over, but we'll be here, and have a wonderful weekend, and we will see you all next month.